Welcome, everyone. As you join, I'd love for you to add your name and your organization and location to the chat box. It's nice to have a good group here today. Just so everyone knows, the meeting is being recorded. You will get a box on your screen. That's so we can share it out later. But as you join, if you'll put your name, organization, and location in the chat box, that would be great. I'm Allison Frazier. I'm with the National Collaborative for Infants and Toddlers. The NCIT is an education and advocacy movement committed to ensuring that every child prenatal to 3 and their families have what they need to thrive. NCIT is committed to advancing promising prenatal to 3 policies to create and expand systems of support for families, reaching every parent and child. NCIT.org is here to support you in taking action to help all babies and toddlers thrive, and we encourage you to learn more about us at ncit.org and consider becoming a member, which opens doors to no-cost technical assistance, online grassroots network of advocates, trainings, and so much more. So check us out in the link that my colleague Andrea is going to put in the chat box in a moment. But today we are focused on making it easier for parents to access programs and services for infants and toddlers, spreading the First 5 for All model. Parents often meet barriers when trying to access services for their families. We all know this all too well. Different offices, so many forms, lots of waiting. And really, shouldn't there be an easier way for families to access public programs and services? So today we're going to learn more about and connect with South Carolina, Nevada, and Texas, and the work that's happening in each of those states to help make it easier for parents to access the services and programs that'll help their children thrive. We hope what you learned today and the connections made will help make similar projects possible in every state. We will hear from the state representatives, and then we'll be open for a Q&A session. So when we get to that section, feel free to take yourself off mute or raise your virtual hand or simply place your question in the chat box. If it's easier to place your questions in the chat box as we go along so you don't forget them, that's fine too. And we'll get to as many of those questions as possible. But if there's more questions than time, we'll make sure we get the answers in writing out to all of you. So until the Q&A period, we ask that you keep yourself on mute so we can hear best. And without further ado, we can begin. So first, I have the pleasure of introducing Rachel. Rachel Hatton-Moore is South Carolina's inaugural 2-generation systems manager. As the 2-gen systems manager at the South Carolina Early Childhood Advisory Council, her role is to support and advance efforts to align agencies, policies, and delivery systems in support of whole family practice. She serves as the project manager for First 5 South Carolina. The 2-gen approach is a powerful tool in creating efficiencies, centering families, and improving outcomes for families. Her background involves over a decade of work in developing programs and managing projects that elevate the voices and lived experiences of family through human-centered design. Welcome, Rachel.
Thank you so much for having me today. I'm really looking forward to sharing our work with all of you here. I am, of course, South Carolina's inaugural 2-generation systems manager, and in that role, I am able to be the project manager for First 5 South Carolina, which I'll talk about in a moment. But what I want to start with is telling you about First 5 for All. First 5 for All work began in 2023, funded by the Pritzker Children's Initiative and now the David and Lucille Packard Foundation. And the work of First 5 for All is sharing information about First 5 and our process through technical support and assistance to other states who are interested in starting early childhood coordinated eligibility and enrollment portals, specifically so that families can find what they need so that they can have all the resources at once so that they and their children can thrive. So we are available to do this work with you, and you can reach out to us through first5sc.org or First 5 for All. And when you get there, we have a toolkit available for other states that showcases our process and our lessons learned. And so really briefly, I want to share with you some of our primary lessons learned. Build will from the start, number 1. have all of your stakeholders understand what the benefits of a system like this would be, primarily in helping families gather more information and make informed choices about early childhood programs, and as a family facing tool for them, as something they need, want, and deserve as constituents in our early childhood systems. Then also making sure that we communicate with stakeholders all throughout development so that they understand what's happening, the timeline, and have direct input into the way things are happening, and even some of the features on the site, to make sure that this is really a tool that belongs to everyone. So I wanted to start by sharing with you what South Carolina's early childhood system looks like. And so we mapped the state and federal flow of funds into South Carolina's early childhood system as part of our preschool development grant work that began in 2019. With a planning year. And what we found, of course, is nothing new to anybody else. It's diffuse. There's lots of agencies who provide information and resources and services. And sometimes the funding comes to a program that's not actually the direct implementer, or funding source and program name at one agency may not be the same as the other. And no family that I know of goes looking for McBee funded services, right? They're looking for a home visiting program if they know about that, or maybe even just the name of the provider in their area. And so we wanted to make something that was easier for families, because what we heard from the families that we listened to is that it's hard to find support. It's hard to find what you're looking for. It's hard to take the time to do that. When you have many different children in the household, you're filling out forms for each of them, and it can be really problematic, really time consuming, really confusing to navigate this system. And so it was our statewide parent needs assessment that really began letting us know that families didn't have enough time, and they wanted more time, and they also wanted to be able to make informed choices about early care and education options for their children. I'm also the facilitator of the South Carolina Family Voice Council, and we hear from members all the time what a barrier this is for families. So I'm going to walk you really briefly through what First Five looks like. So this is the main screen. When you go there, the main draw is to check your eligibility for over 40 programs and services across more than 11 state agencies, including now about 5 local agencies. And so we're going to follow the story of Pamela Cooper, who is the single parent of a 4-year-old and a 2-year-old. And she came today to First Five to look for programs for her 4-year-old for public pre-K. And she also has concerns about her 2-year-old and their development, but she's not quite sure, like, if a child care center would be the best option, or if there are other programs and resources. So we're going to start by completing the screener for the 4-year-old. And we ask for the child's date of birth, because what we know in early childhood is that program eligibility is ranging from prenatal through 5 years old, and it really depends on date of birth. So we ask that, and we filter that all in the back end. Then we ask for their address, because in South Carolina, we have many programs that are fully statewide, but we also have many providers that only serve a few counties in their service area. And so we want to make sure that whether you are in the mountains of South Carolina or at the coast, you're able to find just the programs that are available to you in your community. So this screen brings together all of the eligibility criteria across all of the 40 plus programs that are included on First Five. So you'll see things like, my child or family is experiencing homelessness. That question's already only asked once, even though it might be criteria for 30 programs. And we also have this written and approved by the participating programs and agencies to be in plain language. So this is tested by families so that it is clear. It's written at a low grade level. Families have told us that it's easy to understand and it's not offensive because we're asking really sensitive questions like, my child has been abused or neglected, or someone in my household has experienced mental health issues. And so we really wanted to be sensitive to that. We also ask income because income for programs can be determined by federal poverty level. It can be determined at anywhere from 50% of federal poverty level all the way up to 200. And it changes based on fiscal year, calendar year, program year. And we make sure all of that is managed so that families can enter one simple calculation of income and find out what they're eligible for based on that. And the participating programs have agreed that asking for a simple gross income by year is the easiest way to get this information from them at this point in the process. So once you enter those first few pieces of information, you're able to see, and Pamela Cooper can now see what programs her 4-year-old would be eligible for based on what information she entered. And she would find that she is eligible for preschool programs. But she also finds out that her family is eligible for WIC and nutrition assistance, which could really benefit her household, but she didn't know her child was still eligible for. And also, making sure that her her child who she's concerned about their development is able to get in touch with early identification and referral services. So these programs are all on one screen. The ones that you'll see on the next screen are below this Apply Now button. So any of these programs that are above the button, Pamela can apply for now on First Five. And these programs she can navigate to independently to learn about their options for enrollment and what their application process is. I also want to point out at the bottom, the Start Over button. If you are a home visitor and you are doing a visit with a family and helping complete First Five with them for referrals and just information for them, if you are concerned about their privacy, you just hit Start Over and then you can do it all again at the next home visit without any of their information being shared. And the same is true here for emailing you your results. So say Pamela only has 5 minutes right now. She can't read about all of these programs she's eligible for, but she can email them to herself and come back later when it's convenient. Also, she can find out which providers are in her area nearest to her or nearest to her employment to make things easy. And so she can select by program and filter by distance to learn about the providers in her area. And then if she does choose to apply for any of these programs, she can apply as a guest, like she's on, any other website where she might be purchasing something, to use that 5 minutes she has to go ahead and submit an application. And if she decides that she needs more time or she needs to gather different documents, she can create an account, have access to a secure document vault, preserve her applications in progress, and then come back later to finish. So we start with a basic information screen. The information she would fill out here is then populated onto each of the applications, and this is the questions that are asked across all of them. So she only has to enter it once. And then you'll see that she has access to the programs that were on her results screen. And that way she can choose which program best fits her needs based on their distance and which best meets what she thinks would be best for her child. And at that point, she would submit and then also be informed of what the next steps are in the process, when she can hear from someone, how she can expect to hear from them. We received feedback from families that that's really important in knowing how to enroll in a service. So we know that First Five is working. And the way we know this is because we see that parents are coming, over half of them are coming outside of normal business hours for government offices. And so you'll see lots of weekend visitors, lots of before early morning visitors, and lots of afternoon and evening visitors, like you'll see in the dark blue on the screen. And so this helps families be able to find information when they have the time, and they have that power now to find that information in one place. We also know it's working because, more importantly, we hear so from families. And Katie told us that First Five was really influential and impactful in finding resources for her child early when they learned that her child has a disability. So I look forward to any questions you have and providing more information to you about First Five and First Five for All. And that is the end of my slides.
Thank you so much. There are lots of great information in there, and I'm looking forward to getting into the Q&A session. But right now, I have the honor of introducing the team from Nevada. Denise Tanada is the Early Childhood Comprehensive Systems Advisor with the Children's Cabinet. Denise has been working in the field of child advocacy in Nevada since 1998. She has extensive experience conducting applied research and policy analysis on children's issues, with an emphasis on translating research and data to improve policy and practice. In addition to numerous academic papers, reports, and publications in the fields of child welfare, early childhood education, and children's health, Denise has also presented on legislative advocacy focused on empowering individuals towards collective action. She previously served as the executive director of the Children's Advocacy Alliance, a senior scholar at the Lindsay Institute at UNLV, and also served as the executive director of the Nevada Institute for Children's Research and Policy in the School of Community Health Sciences at UNLV. And these will also be joined by Lynn Perdue, a principal with Perdue Marion and Associates. As a public relations practitioner for more than 30 years, Lynn established Perdue Marion and Associates in 2002, which provides strategic public relations, government affairs, digital marketing, and community outreach services. Lynn's talents in creating synergistic relationships, working with diverse individuals to align their vision, and applying strategic initiatives to move the needle of both public opinion and bottom line profits has benefited the agency's clients across industry spectrums. Over her extensive career, Lynn has developed and executed myriad public awareness and community betterment campaigns that don't just respond to trends and changing tides, but also help motivate them. So I'm happy to turn it over to Denise and Lynn now, and really proud of myself that I said Nevada the whole time and didn't slip into my bad accent. So there you go.
Thank you, Allison. I was actually going to congratulate you on saying that correctly. So hello, everyone. As Allison said, I'm Denise Tanada. I'm the Early Childhood Comprehensive Systems Advisor to the Children's Cabinet, which is a statewide nonprofit organization in Nevada, focused on providing a wide range of programs and services to children and families. The Children's Cabinet serves as the backbone agency for the newly launched First Five Nevada campaign, which was developed with the support of multiple partners, including our amazing marketing and outreach team led by my co-presenter today, Lynn Perdue. And Lynn Perdue will introduce herself in just a few minutes. Next slide. Like other states, we in Nevada recognize the need to improve knowledge of available programs and services, as well as opportunities to expand access, particularly for our most underserved and vulnerable populations. Next slide. First Five Nevada evolved through a convergence of systems-focused initiatives and the availability of key resources to support development and implementation. For us, these included the HRSA, Early Childhood Comprehensive Systems, or ECCS, Health Integration Grant focused on aligning and coordinating Nevada's early childhood system, and the Nevada Early Childhood Advisory Council strategic plan, which was focused on systems improvements. Both of these initiatives included key stakeholders from across Nevada's early childhood system, and it really was an opportunity for a unified vision and the development of key priorities to improve our early childhood system. Next slide. Those identified key priorities for these systems initiatives included, but were not limited to, increasing equitable access to early childhood programs and services, and increasing awareness, advocacy, and support for Nevada's early childhood system. Next slide. Because we had developed these cross-sector systems level priorities, we were able to quickly identify and secure funding for this initiative through 3 primary sources. So the first was the American Rescue Plan Act, which was administered through the Division of Welfare and Supportive Services through our Child Care and Development Program. Also through our preschool development grant, birth through grade 5, through the Department of Education and our Office of Early Learning and Development, as well as our HRSA Early Childhood Comprehensive Systems Grant, which is held at the Children's Cabinet. Next slide. This alignment of vision and resources allowed us to move rather quickly to develop and launch First 5 Nevada. I will say it was also extremely helpful that First 5 South Carolina had already established a similar system and were able to connect us with their developers 37 Gears. From conceptual design to launch took us about 8 months to complete. Next slide. I will say having the Children's Cabinet serve as the backbone agency for First 5 Nevada significantly impacted our ability to launch quickly. We had established partnerships with the state agencies who fund and administer many of the early childhood programs and services, as well as the community-based organizations that provide those frontline services featured in First 5 Nevada. We were able to use publicly available information as well as our existing relationships to establish the initial matrix of services, including the detailed information on program eligibility requirements and application processes. This process enabled us to reduce some of the administrative hurdles that many state agencies face when they try to launch new programs. Next. Much of the work we needed to start and build out First 5 Nevada was already underway, including the development of a comprehensive list of early childhood programs and services. We were able to utilize this information and build upon it to establish the matrix needed to construct our eligibility portal. Additionally, due to the prior efforts involved with our system coordination and alignment work, we were able to quickly build support and cross-sector coordination for the establishment of the resource, which helped to fill in an identified gap for both our public and private partners. We also utilized existing resources and staffing supports to help strengthen the initiative, including our Nevada Early Childhood Family Leadership Councils and our existing resource and referral teams to ensure that we could provide personal referral support to families who need extra assistance finding programs and services and or applying for those programs. Next. As mentioned, the engagement of parents and families in the development and implementation of First 5 Nevada has been absolutely critical. In the early stages of our efforts to develop a comprehensive marketing and outreach campaign, we conducted market research and focus groups to identify specific needs. We also worked with our parent and family leaders to conduct beta testing of the site, enabling us to make critical adjustments to ensure user friendliness and to address their specific needs. And we're in the process now of establishing a First 5 Nevada Parent Ambassador Program at the request of our parent leader groups who want to be more engaged in supporting the vision and outreach to promote and improve First 5 Nevada. It's also very important to note that we've collaborated across our aligned initiatives to ensure that all parent leaders receive compensation for their participation in all activities, and that we're providing them with the support, technical assistance and resources that they need. Next. As I mentioned, having a comprehensive marketing outreach campaign has been critical to the success of First 5 Nevada in our first 5 months of operation. Our marketing outreach team, led by Purdue Marion Associates, were involved with the development, coordination, and implementation of the campaign from day one. So at this time, I'd like to invite Lynn Purdue to talk a bit more about this essential aspect of First 5 Nevada.
Thanks, Denise. So as Denise mentioned, one of the largest distinctions of, go back, please. One of the largest distinctions of First 5 Nevada is that it was fueled by a well-funded, multifaceted marketing campaign. To do this, we assembled a team of public outreach and marketing professionals who provided expertise throughout the geographical areas of our state, both north, south, and rural. We also have partners who focus specifically on very hard to reach populations, including Black, Hispanic, and tribal communities. Traditional mass media, such as outdoor television and newsprint, were utilized to create overall awareness for First 5 Nevada. And we used only Nevada children in our advertising and marketing materials, and their smiling faces just shine brightly from us everywhere. They waved to us from billboards, they called out to us from television, they invited us into the print to learn more. A web-based digital capture sequence was implemented to create trackable inquiry into our website. Digital advertising in the form of banner, display, and video ads, including programmatic and paid social media advertising, offered parents a direct link to the campaign site. Next slide, please. To give you some insight into the success of the campaign, I'm going to share with you some statistics that we gathered from April 15th to September 10th of this year. Next slide, please. So you can see that television advertising delivered 21.4 million impressions, while our outdoor provided 86.9 million impressions. We used newspaper and radio in supporting roles throughout our campaign. Next slide, please. Digital advertising was a large portion of our budget, as you can see by the wide variety of platforms that we utilized. Through digital alone, we secured 10.5 million tracked impressions. Next slide, please. And during this time frame, we saw 125,700 unique website visitors, with a total of almost 670,000 total site visits. We also had more than 5,000 eligibility screenings completed, and those came from every part of our state, including some of our most rural communities. We were really thrilled to see the website traffic show that each user visited the website more than 5 times, which really speaks to the site's traction as a reference source for parents. Next slide, please. All the paid efforts were supported by a robust grassroots outreach campaign that overemphasized vulnerable and hard-to-reach populations. The statewide team developed partnerships with nearly 150 community-based organizations throughout Nevada who work with our representative families. We worked with them to introduce First 5 Nevada website, the eligibility portal, and its benefits. These trusted partners already have relationships with our families, so they really help us overcome a lot of the barriers that exist. Additionally, we booked and staffed 150 in-person grassroots events to meet families where they are, and we placed 50 media stories in outlets throughout the state. We believe that developing relationships with our trusted partners throughout the state is where the sustainability for First 5 Nevada exists, and that will be what keeps it growing long after advertising and outreach and funding expires. When we launched the website and eligibility portal, we held a series of trainings for these organizations so that they truly understood how to use the portal, much like Rachel illustrated to you, but also so that they were aware of the robust amount of information and resources available to families through our website. We worked to provide as many resources as possible to these community partners so they can help us also market First 5 Nevada to families. We created a toolkit that includes flyers, posters, newsletter articles, banner ads, videos, photos, coloring sheets, and so much more. And all of these are available in both English and Spanish. Another distinction for First 5 Nevada is our publishing venture. Each month, we publish 6 to 12 articles on the website. These range from spotlights on specific programs and services, profile pieces on parents who've become involved in the early childhood system, community resources that are available, upcoming events, and so much more. We then use these articles to draw traffic to our website. They're included in our monthly newsletters, and we do both an English and a Spanish version each month. And they're also used as content on our social media channels, again, to help drive people to the website to explore more about First 5. With that, I'll turn it back over to Denise to talk about some key takeaways.
Thank you, Lynn. Off script, but one of the biggest key takeaways is partner with a marketing and outreach team who is fantastic. Our engagement numbers have far exceeded our expectations. I also wanted to note here too that we're utilizing a lot of the data and not just what we would consider some of the traditional analytics, but really, I think going back to Rachel's point of really looking at traffic on the site, what are the questions that people are asking about? What are they searching for? Not only to improve our website and our portal, but also to look at how we can improve our early childhood system. So going into some of our key takeaways, next slide. Funding and fiscal resources, I think, is probably key. We were very fortunate to begin the campaign while additional funding through the American Rescue Plan Act was available. I think a lot of people are probably, I know one of our first questions was, how much does it cost? I think that varies depending on the state, but I will say that our initial first year of investment has been about $2.5 million. And a significant portion of those funds have been directed to strategic marketing and advertising. And it doesn't include some in-kind resources we've received for staffing assistance, particularly through our First Step Early Childhood Comprehensive Systems grant. I would say too, to make sure that you're thinking about a sustainability plan, particularly if you're using grant funds or one-time funds, to make sure that you can sustain and support not just the technical aspects, but as Lynn demonstrated, really having the funding to continuing the marketing and outreach efforts are really, really critical. Next slide. There was a lot involved in not only developing First Five Nevada, but in keeping it going and making improvements, which we're continuing to do. Partner engagement is critical. So setting up trainings, having staffing capacity to maintain relationships, and providing those necessary resources to partners is key to success. We've also set up a process for assessing requests to have programs or resources included on the First Five Nevada website. That includes a cross-sector advisory committee, as well as a system for hearing appeals for any denials that take place. We wanted to offer some flexibility in ensuring that we could include a comprehensive array of programs, resources, and information, but balancing that without providing so much information that it becomes overwhelming for parents and families that are utilizing the site. Next slide. The First Five, as I mentioned, First Five Nevada website, eligibility portal, newsletter have provided us with really amazing opportunities to gather information and insights to help us improve not only First Five Nevada, but our overall early childhood systems. As available funding changes, it's also critically important for us to know which marketing, advertising, outreach efforts are having the greatest impact, particularly aligned with reaching our underserved and vulnerable populations. So having a process for collecting and analyzing that data is important. Understanding what information you have available, including data such as which pages are being viewed most often, what users are searching for. We have implemented an AI chatbot, so kind of looking at the questions that are presented there, as well as what we're receiving through our contact us page, can support improvements to the site campaign, as well as understanding which programs and services are most needed in our communities. And we're also looking at how our brand ambassadors and community partnerships are impacting utilization. While traditional advertising and marketing strategies are important, really engaging trusted community partners and leaders can have a very significant impact. Next slide. Some just additional considerations and lessons learned along the way. I would say know your population and be sure to address their needs. One specific example we had was when we originally created the site, we had a Google Translate. That translation did not work. We ended up creating a second website that's connected, that's in Spanish, and really making sure that we have good translation so the information is accurate for our Spanish speaking audience as well. having clear program, resource inclusion criteria and process in place, and knowing which programs are eligible for inclusion and which ones might not work well. We've gotten a lot of requests from individual service providers, which we have to deny. Also looking at things like complex eligibility requirements. So the system isn't equipped to handle some of those varied income eligibility. So one of our examples is with our Nevada Ready pre-K program, when they added some additional funding and had different eligibility requirements. We weren't able to put both of those in. So just having some processes in place to be able to deal with those. We would say planning is key. So knowing what you want on the site to include. We really wanted to do an emphasis on supporting our early childhood system and supporting families to get involved, in addition to finding programs and resources. And then, as I've said, and I will say over and over again, critical to plan the marketing and outreach as a part of the website portal development, really making that an integral part of your campaign. Next slide. I think that is all for us, but here's mine and Lynn's contact information. We're happy to stay on for any question and answer, or feel free to reach out to us afterward. Thank you.
Thank you so much, Denise and Lynn. I'm excited to hear questions that people have about Nevada and your experience, but thanks for sharing with us. And I now have the opportunity to introduce Allison Wilson, who's joining us from Texas. Allison is the Deputy Director of Program Policy and Quality Initiatives in the Child Care and Early Learning Division at the Texas Workforce Commission. As the state's co-administrator for the Child Care and Development Fund, Allison leads state-level efforts to increase access to high-quality childcare, promote early learning, and foster long-term self-sufficiency for Texas families. Allison serves the Texas Early Childhood Intervention Advisory Committee and on the Workforce Solutions Capital Area Board of Directors. Prior to joining TWC in 2016 as a child care policy analyst, Allison held diverse positions in both the public and private sectors, including 6 years as an early childhood educator. Thanks for joining us today, Allison.
Hi, well, thank you for having me. So good afternoon. Again, I'm Allison Wilson with the Texas Workforce Commission, which is the lead agency for CCDF in Texas. So a little bit different. There are only a couple of other, I think maybe 4 total states that have childcare in their workforce agency. So I wanted to say first off that I really appreciate hearing about South Carolina and Nevada's work. And I think you're going to hear a lot of the same themes in what I share with you today. I do realize we're short on time, and I think my material is pretty brief, so we will have time for questions. You can go ahead to the next slide. Okay, and this is my only slide. So in Texas, we're still in the early stages of our journey. We started with an informational website, which was launched by a group of agencies in March of 22. The website is earlychildhood.texas.gov, and you're seeing a screenshot of it on the slide. I also dropped a link into the chat if you'd like to take a look at it. The site came about through our Early Childhood Interagency Work Group, which is a collection of agencies that oversee the majority of birth to 5 programs in our state, and also co-fund a position to spearhead cross-agency collaboration. These state agency partners include the Texas Workforce Commission, the Texas Education Agency, the Health and Human Services Commission, the Department of State Health Services, and also the Department of Family and Protective Services. So this website was designed to provide families with young children easy access to Texas state agency programs, services, and resources. The initial goal was to create a more family-friendly view of available state supports because, you know, family, I think as it was already stated, the family doesn't need to know which programs sit at which agencies or what they're called. They certainly don't need to know our alphabet soup of acronyms. So through this website, they can navigate resources based on child and family-centered topics, which then points them to the right state agency or other partner agency websites. So how did we get buy-in for this effort? Well, we all know that our state agency websites don't tend to be the easiest to navigate. So it was a pretty easy sell from that perspective. Each agency didn't have to change anything about their existing websites. They just had to contribute to and help shape this new website. The fact that we also had a well-established interagency work group comprised of key program decision makers was also instrumental in getting that cross-agency buy-in. So again, that work group had been already well-established and operating prior to the pandemic. So it had been in place for a few years already. So a team of staff from each of these agencies actually guided the site development, and that was with direct input from Texas parents and families. And we did have some outside support for this work through the Child Care State Capacity Building Center, which is one of the Federal Office of Child Care's technical assistance centers. They did have a team there that provided technical assistance for us throughout this project. They especially helped with family engagement and conducting interviews and focus groups with parents and partners to identify what information was needed on the site and to help with how to organize it. And also to work with those stakeholders, those parents, as we iterated through the process to get feedback on designs. So the website is managed by the interagency team, that work group, and the ongoing maintenance is funded by the Texas Workforce Commission with child care funding. We do have funding right now from our preschool development grant that we're planning to use to build the site out further and to add an eligibility screener. And to start with, that screener will cover eligibility for childcare scholarships for public school pre-kindergarten, which is eligibility based in Texas, as well as Head Start and Early Head Start. And we've just kicked off that work, and we're expecting that new phase of the website to be available by early 2026. So that's really my overview of kind of what we've done and where we are now and where we're headed. I did want to provide in closing just a couple of key takeaways, recommendations for other states that might be planning this type of work. So the first one is to have a user-centered design focus. That is really important to involve families in your design and development process. And it doesn't just stop with, once you've got the site out there, you also need to provide mechanisms for ongoing feedback that will support continuous quality improvement. And then the second recommendation that I think Texas would share from our experience is that baby steps really work well. You can see that Nevada and South Carolina are much further along than we are, but we've put ourselves on a path by starting with this informational website. And, you can iterate over time and add more resources and more integrations. You don't have to, come out the door with a full-blown, integrated application for eligibility of all programs. That's going to be a really high hurdle and take you years to do. So baby steps are good. And that is all I have to share. So I'll hand it back to you, Allison, the other Allison.
Thanks so much, Allison. That was great. And I think baby steps is important in so many things that we do. So thank you for that. We certainly have tremendous expertise with us today, and we're going to open the floor now for questions from our attendees. So again, feel free to raise your virtual hand, come right off mute, or place your questions in the chat box. But we would love to have questions from the field. And do we have any? I'll start us off. I know some people can be shy when we're starting, but I would love to know if there were any key partners you needed to get on board in your state to get this off the ground that you haven't mentioned. I know you mentioned some, or if there was any surprising allies that helped you get the project off the ground if other states are looking to build a case for their project.
So I guess I'm off mute already. So.
Thank you.
So as I mentioned, we've got that interagency work group, and we do have key decision makers on that work group, like the administrators for those main programs that serve birth to 5 and in our state. So I think that was critical because those are the folks that could go back and ensure that, you know, their agency executive leadership was going to support the work. And I'll say one like surprising, well, I don't know if it's surprising, but you mentioned in my bio, I'm on the Early Childhood Intervention Advisory Council, the Part C State Advisory Council. So there are a lot of parents on that council. And one of the ways that we identified parents to bring in was to leverage groups like that were already in existence that other programs like McVie or Part C were using. And it was so interesting because they really became champions, like advocates of the website. I was in an advisory council like a few months after we launched, and each of the members gets a chance to share out. And one of the parents was so excited about being part of this work that was her share out at the advisory council, was that, yeah, we've got this great new website as a state, and recommending everybody go use it. So I hadn't even known that she was part of the family focus group. So it was wonderful to hear something come around like that so organically. But so leverage those existing human resources you have.
That's amazing. Does anyone else want to jump in on that?
Yeah, I would love to add that, you know, from the beginning, we started building will, right? And so when we talk about that, we mean sort of at all levels, right? So we worked with system navigators, we worked with parents, we also talked to legislators about what this is and how complicated and you know, our mixed delivery system is. And so we had a lot of people addressing the problem and listening to the problem. So when we proposed this as a tool, it sort of made sense, right? So we sort of laid the groundwork that way. And there was also a big movement to coordinate more among us. So we really took advantage of the preschool development grant funding to sort of pull together a coalition. And we started with really what was considered sort of a test case, which was Palmetto Pre-K, which is also one of our state funded now portals that we manage at the Early Childhood Advisory Council. And so that started with all of the agencies involved in public pre-K in our state. And we built an eligibility portal there, and then recognized the need for having that really across the entire early childhood system, not only in early care and education. That's really how we started. And then we also took the approach for governance of having our Early Childhood Advisory Council and all the leaders on that, from the legislature, from different agency heads, to vote to adopt it as a project of the ECAC, which really gave it that legitimacy as a project, as a coordinating effort between these agencies.
Great. Another question here in the chat box. Would love suggestions on how to help lead organizations learn to value parent and provider voice. I see you nodding, Denise. Do you want to take that one?
Yeah, I'd be happy to. I think we were fortunate in the fact that, one, we had recently established our early childhood advisory, or our early childhood parent family leadership councils as part of our HRSA Early Childhood Comprehensive Systems grant. So they were really integral in, providing feedback in development stages as well as testing the site. We also had established a child care provider action committee, which we were able to integrate into it to really look at their needs. So I think some of that existed, but I think we're also utilizing First 5 Nevada as a tool to raise up the voice of parents and providers across the state. I think, as I mentioned in our comments, we are very much focusing, initially, we've only been launched since mid-April, right? So we're still relatively new. So initially really focusing on getting parents connected to programs and resources, but our plan is to really start building up that early childhood system piece and supporting parents and providers and getting involved in systems improvements. So I think it's a connection point that we didn't have previously in our state.
Rachel or Allison, anything you'd like to add from your state's perspectives?
I don't have anything.
Okay, that's fine.
I can just quickly add that, to echo what Denise said, is we brought the First Five development and testing to our Family Voice Council for their feedback. And they had great ideas, not only about changes we could make on the site to make it clearer in the language, but also about how they wanted to receive information about First Five. What would effective outreach look like to them? Because we really invested in outreach and marketing as a really important facet of the work we were doing, because that was the purpose, right? Parents had said to us they needed to find information, so we should ask them how they want to receive this information. So that was really what drove a lot of that work in the beginning, and doing community meetings to showcase different pieces of First Five during development, because we also did it in a staged, phased approach, because you start where you are, right? And if you're trying to build something sustainable over time, doing it incrementally is really, really important to the process of improving. So I'll stop there.
No, I think that's true. It's something really simple to make sure that you're engaging the people you're trying to reach, but it's a step that's often missed. So that's super important. Question for you, Lynn. Did you recognize or provide incentives for your First Five Nevada ambassadors?
Thank you. Yes. And Denise can probably provide better detail on this, but we do incentivize them to get involved. We've had them help us table at events, and it's really great because they can connect with those other parents and on a common level of, whether it's frustration or success or just the need for information. We've also utilized them in our media stories. We developed partnerships with a northern and a southern television stations, both Channel 5, by the way. And we, included them in some of those media interviews so they could talk about, again, I think Rachel, you were saying, or Allison, you need to know that SNAP exists and, which agency holds that, and then dig through the website and find the thing and all of that, right? So just the ease of finding so much more that they were eligible for than they had thought. But Denise probably remembers better than I do the different aspects that we incentivize them for. But I think it's really important to get them involved in those things so they can see what baby steps of getting involved in the system looks like. Sorry, Denise.
No, it's okay. And I will say too, the idea actually for the ambassadors came from our family leadership group. They wanted to, see how they could get involved, help spread the word. So like I say, this is still in, it started, but it's still in development. But we created with our family leadership councils an engagement matrix. So really identified how do they want to get involved? What would that look like? What support do they need in order to make that happen in terms of training, technical assistance, physical things, t-shirts, flyers and swag, things like that. And then set up really thinking through a scale, like what is the stipend that should be attached to that activity to compensate them for their time. And we worked with our funders. So, we've got funding through our HRSA ECCS grant that helps support some of that. We've got funding through our preschool development, Birth to 5 grant to support those incentives. And the state's actually working on a more formal parent and provider incentive structure to go along with that as well.
Great, thank you so much. And then one final question, how would you say First Five fits into the wider efforts of early childhood systems change? Anyone want to take a stab at that one?
I'd love
Me
to.
too.
Yeah, this is what makes me really excited, right? To talk about how can we use tools that are technology based to better serve the people that we're serving, right? And so civic technology is really important when we think about how can we reach parents the way that many of them are expecting to use technology now. Like younger parents are expecting that the government be responsive to them technologically and create more efficiency in the systems that assist them, right? And so that's what they're asking for. That's what they're demanding. And if we want to stay relevant and actually meet needs, it's incumbent on us to make those changes. And so the work of First Five is to not only be parent-centered and family-centered in our approach to delivering a product, but also that we have to keep in mind the system change that needs to happen to make things like First Five work, right? And so it's continually a push and pull between what is existing and what do we have to change or accommodate to make something like this front door coordinated approach work. And so there are times when it, something like First Five that we've run into, it will highlight some challenges in the early childhood system that we can address through technology and assisting our partners. And so I know that's not a very specific, that's a really high level answer, but Denise might have more examples.
Thanks, Rachel. I agree with everything Rachel said. And I think at least for Nevada, if you go back, my title is Early Childhood Comprehensive Systems Advisor. Like my whole world is, focusing on making improvements to Nevada's early childhood system. And so it was very strategic that I was assigned to help lead and be a project manager for First Five Nevada. So I think, as I mentioned in my presentation, there's so much data and information available through this initiative that can help inform systems work, like say everything from looking at what parents are searching for when they're on the site. I meet with our resource and referral team who do the one-on-one support for families looking for additional assistance. And I meet with them to talk through, like, what are the families asking for? What barriers or issues are they identifying, or are you identifying when they're trying to access services? So then we can then take that information back up to our systems partners to address some of those issues. I mean, biggest example right now for us is parents looking for childcare needs for children with special health care needs or behavioral health issues. It's a real issue in our state, and there's a lack of services. So it's just drawn attention to some of those issues, and it gives us data to back up some of those system changes that we need to make. And that's one example. I've got a whole list.
Great. As we are at the top of the hour now, so I just want to say a big thank you to our presenters. You can continue to put questions in the chat box if you'd like, and we'll get you answers. As a reminder, NCIT offers no cost consultation services. The link is there. You can start a conversation with us, and we can connect you with the experts here on the call or others. But before you jump off, if you would take our really brief post survey here, we use these to improve our trainings and to share with our presenters as well. So thank you again to Texas and South Carolina and Nevada, and for all of you who joined us here today. We really appreciate it, and take our survey.